In the context of a VSD, what is ventricular venturi effect most likely to cause? A. Pulmonary stenosis. B. Aortic valve prolapse. C. Mitral valve prolapse. D. Tricuspid valve stenosis. Answer: B. Aortic valve prolapse. Which of the following is a classic physical sign of a very small, muscular VSD? A. Continuous machinery murmur. B. Diastolic decrescendo murmur. C. High-pitched, short mid-systolic murmur that ends before S2. D. Absent S1. Answer: C. High-pitched, short mid-systolic murmur that ends before S2. In patients with VSD, a pulse paradoxis is not typical. However, what might a double-peaked arterial pulse indicate in a post-surgical VSD patient? A. Residual shunt. B. Mitral regurgitation. C. Hypertrophic obstructive cardiomyopathy, HOCM, Physiology. D. Tamponade. Answer: C. Hypertrophic obstructive cardiomyopathy, HOCM, Physiology. Which of the following describes the inlet VSD, atrioventricular canal type? A. It is located in the outflow tract. B. It usually closes spontaneously. C. It is positioned posterior to the septal leaflet of the tricuspid valve. D. It is always associated with tetralogy of Fallot. Answer: C. It is positioned posterior to the septal leaflet of the tricuspid valve. A patient with a VSD undergoes an ECG that shows a RSR pattern in lead V1. What does this most likely represent? A. Left ventricular hypertrophy. B. Right ventricular volume overload or conduction delay. C. Acute myocardial infarction. D. Wolff-Parkinson-White syndrome. Answer: B. Right ventricular volume overload or conduction delay. Why is a VSD murmur usually not heard immediately at birth? A. The hole hasn't formed yet. B. High neonatal pulmonary vascular resistance, PVR, limits the pressure gradient. C. The ductus arteriosus masks the sound. D. The infant's heart rate is too fast. Answer: B. High neonatal pulmonary vascular resistance, PVR, limits the pressure gradient. Which cardiac catheterization measurement is used to calculate the systemic to pulmonary shunt ratio, QP/QS? A. Fick principle, using oxygen consumption and O2 saturations. B. Thermodilution alone. C. Coronary angiography. D. Pulmonary wedge pressure only. Answer: A. Fick principle, using oxygen consumption and O2 saturations. What is the standard antibiotic prophylaxis recommendation for a patient with a completely repaired VSD, with no residual shunt, after 6 months? A. Lifelong prophylaxis for dental work. B. Prophylaxis for 10 years. C. No prophylaxis required. D. Prophylaxis only for GI procedures. Answer: C. No prophylaxis required. Which of the following is a characteristic of malalignment VSDs? A. They are usually very small. B. They involve the displacement of the outlet septum. C. They always result in right to left shunts at birth. D. They are strictly found in the muscular septum. Answer: B. They involve the displacement of the outlet septum. A 10-year-old with an unrepaired VSD presents with cyanosis and clubbing. Her hemoglobin is 19G/DL. What is the most appropriate next step? A. Immediate surgical closure of the VSD. B. Iron supplementation. C. Evaluation for Eisenmenger syndrome, closure is likely contraindicated. D. Start high-dose aspirin. Answer: C. Evaluation for Eisenmenger syndrome, closure is likely contraindicated. Which of the following is the most common complication of a percutaneous device closure of a VSD? A. Stroke. B. Heart block or arrhythmias. C. Pulmonary embolism. D. Aortic dissection. Answer: B. Heart block or arrhythmias. What is the hand grip exercise effect on a VSD murmur? A. Increases the intensity of the murmur. B. Decreases the intensity of the murmur. C. Has no effect. D. Makes the murmur diastolic. Answer: A. Increases the intensity of the murmur. Which of the following VSD types is most likely to be associated with an interrupted aortic arch? A. Small muscular VSD. B. Posteriorly malaligned conoventricular VSD. C. Supracrystal VSD. D. Gerbeaud defect. Answer: B. Posteriorly malaligned conoventricular VSD. What is the most common cause of death in adults with unrepaired VSD who develop pulmonary hypertension? A. Pneumonia. B. Sudden cardiac death or progressive heart failure. C. Renal failure. D. Liver cirrhosis. Answer: B. Sudden cardiac death or progressive heart failure. If a VSD is described as restrictive, what does that imply about the right ventricular pressure? A. RV pressure is equal to LV pressure. B. RV pressure is higher than LV pressure. C. RV pressure is significantly lower than LV pressure, normal or near normal. D. RV pressure is 0. Answer: C. RV pressure is significantly lower than LV pressure, normal or near normal.